Congratulations! It's time to take your new baby home. Whether it's your first baby or your third, we would like to do some discharge teaching to help with any questions that you may have.
While you were here at the hospital, there were some routine screenings done. We checked jaundice levels, did cardiac testing, and an audiologist did a hearing screen. In addition to these, the first PKU, or genetic screen, was drawn and sent to the state. A second PKU will need to be drawn by your pediatrician. The second PKU slip will be given to you at discharge to take to your baby's appointment. Feeding your baby. You will want to continue to feed your baby every 2 to 3 hours. This will result in the 8 to 12 feedings necessary for the nutrition and hydration of your baby. You should see 3 to 4 wet diapers and at least 1 to 2 stools every 24 hours for the first 5 days. By day 6, you should be seeing 5 to 8 wet diapers and 3 to 4 stools. Your baby may cluster feed. This is very common and occurs most often in the evening. Watch your baby's feeding cues. These may include fingers and fists in the mouth and smacking of the lips. Crying is a late sign of hunger. If you can catch them earlier when they start showing these cues, it may be easier to latch them and have a good feeding. Bathing your baby. You will sponge bathe your baby until the cord stump falls off. You do not need to bathe your baby every day. A sponge bath every 2 to 3 days is adequate. The temperature of the water should be just above 100 degrees Fahrenheit. This temperature will prevent chilling or burning your baby. Remember, never leave your baby unattended around water. When taking your baby's temperature, you can follow these simple instructions. Lift your baby's arm and place the smaller end of the thermometer well into the armpit. Lower your baby's arm and hold it there, close to their body. Press the start button. Keep your baby's arm down and the thermometer in place until it beeps. Your baby will likely develop a newborn rash. This can be caused by exposure to hormones in the womb or change in environment. You do not need to do anything. Keeping their skin clean and dry is all the treatment that is needed. This can last for weeks or even months. Jaundice is a buildup of bilirubin in your baby's system. This buildup can cause a yellow hue on your baby's skin. Bilirubin levels have been monitored here in the hospital and will continue to be monitored by your pediatrician. If necessary, your nurses or pediatrician may ask you to supplement with pumped breast milk or formula to hydrate them so they will pee and poop more efficiently. If you have a little boy, you may have chosen to circumcise him. Your nurse has instructed you on the care of the circumcision. If you have questions or need further instructions, please ask before discharge. Your baby will always sleep on their back. Be sure that there is nothing in the crib but a tight-fitting sheet and baby. It is important that you never shake your baby. Crying is your baby's way to communicate. Know your limits. Put baby in a safe place and walk away if they're crying inconsolably and you need a break. Knowing when to call the doctor is important. These few things will help you decide if a call is warranted. If your baby has consistent or inconsolable crying, has vomiting or diarrhea, refuses to eat 2 times consecutively, unusually sleepy and hard to wake, difficulty breathing, or has a temperature 97.8 degrees or lower or 100.4 degrees or higher. You may also call your pediatrician or baby doctor with anything that you may be concerned about. Taking care of mom. Mom's uterus will begin shrinking back to pre-pregnancy state immediately after birth. Mom may feel some cramping as this process takes place. This is often felt more intensely when baby is feeding at the breast. Mom will continue to bleed for several weeks after giving birth. This will taper off in amount and begin to get lighter in color. Call your doctor if mom is passing clots larger than a golf ball, soaking through more than 1 pad an hour, or has a foul-smelling discharge. You will potentially go home with pain medication. Do not drive while taking narcotics. Continue to take your stool softener as directed by your provider. This is called Colace. Any other medication should be approved by your provider or a lactation consultant if you are breastfeeding. Mom may experience sore nipples as she begins to breastfeed. A good latch with every feeding will be important. If you have any of the following symptoms of a clogged duct, it will be important to reach out to the lactation consultant for advice. Blocked milk duct symptoms include a small, hard lump that is sore to the touch and very tender in your breast, redness, a hot sensation or swelling that may feel better after nursing. If you feel achy, run down, or feverish, it could be a sign that your clogged duct has become infected and you should see your doctor. If left untreated, a clogged duct can evolve into mastitis. Don't ignore these symptoms. Castle Rock Adventist Hospital offers a lactation clinic. If you have any questions or concerns or need help navigating a breastfeeding issue, please join us for the outpatient lactation clinic on Thursday afternoons from 12:30 to 2:30 in the conference center on the first floor. This is a free clinic and you can drop in at any time between these hours. Other keys to recovery. Drink plenty of water, which includes 8 to 10 8-ounce glasses per day. Continue to eat a well-rounded diet and continue on your prenatal vitamins. You have been instructed to use Americaine spray and witch hazel pads to help with your episiotomy or tearing. These can be both bought over the counter. To reduce urinary incontinence after childbirth, Kegel exercises can be done to strengthen the pelvic floor. Any stitches that you do have will dissolve on their own. To help in the recovery of the vaginal area, it is recommended that nothing be put into the vagina for 6 weeks. This includes intercourse and the use of tampons. If you have a C-section, there are a few things that you will need to know. You will visit your healthcare provider at both 2 weeks and 6 weeks postpartum. Watch your incision for signs of infection. Foul-smelling discharge from the incision site is an indication that this might be occurring. Your steri strips will fall off over the next several days. You may shower and pat the incision dry. If you have stitches, your provider will remove them at your 2-week visit. Do not lift anything heavier than the baby until returning to your healthcare provider. Do not drive while taking narcotics. Your family will go through a lot of transitioning over the next several weeks. Mom will encounter some hormonal changes as her body releases pregnancy hormones and begins making lactation hormones. Mom may have some baby blues right after the baby is born. She may experience sudden mood swings and cry for no apparent reason. Postpartum depression is described as a mood disorder that can affect women after childbirth. Mothers with postpartum depression experience feelings of extreme sadness, anxiety, and exhaustion that make it difficult for them to complete daily care activities for themselves or their baby. Call your healthcare provider immediately if you feel like harming yourself or baby. Reasons to call your provider. If mom is experiencing severe abdominal cramping, constipation that does not respond to diet changes, pain or burning with urination, drainage around the incision, a red spot or lump on the back of her leg, or a temperature greater than 100.4. Anything else that you may be concerned about warrants a call to your healthcare provider. Congratulations! Taking your baby home will be an exciting time in your lives. Please feel free to call our birth concierge with any questions or concerns that you may have after taking the baby home. It has been a pleasure here at Castle Rock Adventist Hospital to take care of you and your new family.